I'm Dr. Heidi Waldorf from Mount Sinai Hospital in New York, New York. Today I'm going to focus on correction of the lower face, jawline, and pre-jowl sulcus. When you look at a patient, sometimes it's very obvious, if they haven't had filler before, how to start. It's more complicated when we need to adjust or add filler to the person who's already had. When we look at her face, we see that she's nice and full up front, and she even has nice fullness in the mid-face. However, when we start to look in the pre-jowl sulcus, she is losing volume in that area. Make a frown face for me, and you can see some of that is her depressors. Open and make a frog face. That's perfect. So you can see some of that is muscular. Relax. However, some of that is also loss of volume, which also adds to fullness on each side. When we look from the side, we can see that she is starting to get a little jowl and starting to lose some of the definition of the angle of her jaw. So we can correct all of these by injecting some filler, giving a nice, smooth, continuous line from the chin to the ear. However, because of the location and the fact that she has a lot of rounding to the face, and I want to add some definition here, I'm going to use Radius here. We're starting with botulinum toxin. This is Allergan's Botox for her depressors. I'm going to be putting in 2.5 units at each location. The result will be subtle, but by putting it here, she should have softening without it affecting her ability to smile. She really has an obvious lack of volume, almost a thumbprint there. But instead of starting high, I'm going to start along the jawline to try to give that lift without making it too full. This is Radius mixed with 0.8 cc's of Lido without epinephrine. I'm going down to bone and injecting directly on bone while feeling it fill. Molding it, you can see we're already starting to straighten that line. Again, a little higher. And we've given fullness. Here she still has a little bit of a divot, a little bit of a depression, and here it's straighter, and it will get better still when the toxin kicks in. Now for the posterior jawline, nice straight line here. So for a woman, I like to go straight from this point to the ear. For a man, I will inject separately to try to create more of the sharp angle. So already we've lengthened the area. I now want to link these areas to create that elegant, sharp demarcation of the jaw. I'm in the skin, I'm right above the bone, sliding across. molding it. And you can see the nice sharp line is starting. Again. And here I see she looks like she has what's a little scar that's causing a little indent. Just going again down to bone. And we've made this side smoother and straighter. And when you look, you can see that this side has a much more elegant, straight, pulled upward look. This side has more indentation and the jowl. To improve this further, I want to give her a little more definition of the cheek. So to make the lower face better, I'm going to just add a bit more here. Again, onto bone. And just giving her a little more of an arch upward. And her face on this side is now has more angle, more definition. It's subtle, but she doesn't look overfilled.